I'm Dr. Amer Raza. I'm a consultant gynecologist in London. My special area of interest is endometriosis, pelvic pain, fibroids management, and irregular periods. And my area of expertise are in laparoscopic and keyhole surgery. Today I want to talk about laparoscopic surgery. What is laparoscopic surgery? How is it done? What techniques do we have? What are the benefits of laparoscopic surgery as compared to open approach? And what are the risks associated with the laparoscopic surgery? And are there any alternatives you can be given to laparoscopic surgery? Laparoscopic surgery is a technique in which a small camera tube is inserted in the abdomen through the belly button. This procedure is carried out under anesthesia, so you are sleeping at that time. In laparoscopy, a camera tube is inserted in the abdomen through the belly button. Belly button approach is the most common approach. However, it is not the only approach, as at times disease will mean that the camera is inserted at different places. After insertion of camera tube, abdomen is filled with CO2 gas to enable the doctor to see all the structures. The images from the camera are projected on a television screen in front of a surgeon, and the images can be zoomed in and magnified for a better surgical technique and approach. After a laparoscope is inserted, 2 or 3 more small incisions are made on the abdomen to insert the instruments to be able to treat the disease. Laparoscopic surgery has many benefits. Given that it's a small incisions on the abdomen and no muscles are cut, the trauma on the abdominal wall is less than an open surgery in which large incisions are made on the abdomen. Laparoscopic approach also allows a better magnification of the structures inside to reduce the risk of injury. Given that it's a smaller incision and surgery is carried out in a magnified, zoomed environment inside the abdomen, the post-operative pain is less, trauma to the tissue is minimal, hence earlier recovery and discharge from the hospital. These benefits of keyhole or laparoscopic approach are absolutely proven as compared to a conventional open approach. Most of the gynecological problems can be treated with a keyhole approach. The use of robotic surgery now is simply an extension of laparoscopic approach, in which same camera tubes are inserted through the belly button. Similar incisions are made on the abdomen, but the instruments are controlled by mechanical arms instead of hands directly by a surgeon. This approach then further adds to the accuracy of the surgery and less tissue trauma with less risks of bleeding. Where laparoscopic surgery has all the benefits, there are risks associated with the laparoscopic surgery as well. I will divide risks into 2 major categories. One is the default risks of laparoscopy being carried out for any condition, and there are specific risks of a typical operation was being carried out. For example, the fibroid surgery will have a different risk assessment and risks profile as compared to endometriosis surgery. And within endometriosis surgery, the risks will vary from a mild endometriosis surgery to complex deep endometriosis surgery, and your surgeon should be discussing all that in detail. I can also divide the risks of laparoscopic surgery into 2 main categories. One are frequent risks and other are serious risks. Frequent risks are pain because of the tissue trauma, port site infection where the wounds are entered, and gas under the diaphragm, giving you pain after the surgery. These are quite common, and doctors will be giving you instructions how to reduce the impact on your health and the recovery phase. Serious risks, however, are very important, and they need to be considered carefully before you make a decision about laparoscopic operation. As the camera tube is inserted in the abdomen, there is risks of injury to bowel, bladder, or blood vessel or other surrounding structures. The risks of these injuries vary between 2 to 3 in 1,000 operation. So risk is less than 1%. However, if someone had multiple surgeries of their abdomen or multiple keyhole surgeries, then the risk will increase and your doctors will individualize your risk given your medical problems. If injury happens to bowel, bladder, or blood vessel and surrounding structure, then at times, mostly this will be detected during the operation and can be managed by the surgeon himself or by calling other experts to come in. But if surgery goes undetected during the operation, such as vascular or bowel injury, then it can have long-term implications. There is also a risk during laparoscopic surgery that though the approach has been agreed to a keyhole approach, but during operation, due to bleeding, injury, or the complexity of disease, may convert the keyhole approach into a conventional open approach. So though most operations are completed with a keyhole approach, the risk will remain to adopt or convert to an open approach. It is also as time possible, though very uncommon, that keyhole surgery was not possible at all due to adhesions, scarring, and operation was abandoned. There is also a risk of clotting, even the risk of clotting in the legs leading up to pulmonary embolism is much smaller in keyhole surgery as compared to open approach. After the surgery, there will be few issues you will have to cope with. One is pain. You should be going home with enough analgesia to help with your pain. Change of diet, pain relief medication, less mobility will lead to bowel, bloating, and constipation. Bloating and constipation leads further to more pain. So I will also suggest that your dietary modification should not start after the surgery. Rather, they should start well before the surgery to have a high fiber diet, drinking plenty of fluids, and a highly nutritious diet before the surgery. After the surgery, I will always advise to have small portions of frequent meals with drinking plenty of fluids along with laxatives. This could be in the form of Movicol, lactulose syrup, but it does take 2 to 3 days for your bowel to return to normality. After pain and bowel issues, mobility is a third thing. Mostly, patients will recover to 60% a week after their surgery, and there's a 90% recovery after a couple of weeks. However, this may vary from patient to patient. Specific problems can impose added risk. These are mostly generalized risks of laparoscopic surgery. But for your operation, your doctor needs to individualize your risk for your surgery. For example, if you're having a surgery as laparoscopic myomectomy, removal of fibroid, there is a risk of bleeding from the uterus, which may need to convert it to open approach, or even needing hysterectomy, which is quite an uncommon thing to happen. If you're having operation for endometriosis, endometriosis can involve rectum, ureters, and therefore risk profile for a laparoscopic management of endometriosis will change depending on the extent and severity of your problem. It is very important that when you're consulting with your specialist, do ask all the questions.